Today we have with us Dr. Ramdeep Ray from Artemis Hospital. He is an expert in liver transplant surgery, and we are here today to discuss with him various important medical related information for patients who are seeking information on liver transplant surgery or any liver related disease. Dr. Ramdeep Ray and his team, they have conducted more than 1500 liver transplant surgery at this center. So we'll be starting with the basic question, Dr. Ramdeep, which disease damage the liver and give rise to a liver transplant? What are the basic what are the disease that give a way to a liver transplant surgery? That is the basic question everyone wants to know.
Yeah, I think there is some understanding already in the general population, but still more people need to know. There are a number of reasons for which the liver gets damaged and you ultimately end up in a liver transplant. But very grossly speaking, we are looking at three basic reasons why someone ends up in a liver transplant. So one would be when the liver is damaged by hepatitis B, two, when the liver is damaged by hepatitis C, and three, when the liver is damaged by alcohol consumption over a long period of time. So hepatitis B, hepatitis C, and alcohol. And sometimes there are some liver tumors for which, like hepatocellular cancer, we call it HCC. So Hep B, Hep C, alcohol, and liver cancers.
So how long, I have everyone know that alcohol is one of the, the biggest reason for any liver related disease. So why alcohol, why is the alcohol one of the biggest reason for liver transplant? Is there any specific reason attached to it?
Alcohol is a hepatotoxin, which means it is a hepato, which means liver, and toxin is like a poison. So alcohol is a poison for the liver. I know it has been sometimes highlighted that a small bit of alcohol can be protective for the heart,
Exactly.
but there's no amount of alcohol which does any good to the liver. So there have been a lot of studies about how much alcohol for how long a duration. But very roughly speaking, if anyone has alcohol regularly, maybe 4 to 5 days a week for around 10 years, then there is a very high chance that he will end up with liver cirrhosis and require a liver transplant.
That's a very information that everyone should understand that liver, alcohol may be, we have heard that it may be good for heart, but it is not at all advisable in a high quantity. So another thing, what is everyone gets to know from various channels that XYZ patient is undergoing a living donor transplant. What exactly does it mean? And you have been performing mostly living donor transplantation here.
Well, yeah, so liver transplant basically is of two types. One is when it is from someone who has died. Someone who has died and the family has agreed that his organs be donated. So someone is brain dead in an ICU and then the person donates. So that is a deceased donor where the donor is dead. And the second larger numbers that happen in Asia is living donor liver transplant. So what is living donor liver transplant? Well, you have one liver, but that liver can be divided in a very precise way with the use of modern technologies. So you divide the liver and give. So if I were to give my liver to you, you are an adult. So I would be giving the right side of my liver to you. Now, why can we donate a liver? The reason we can donate a liver is that when you divide the liver grows back really fast. So the liver grows back to almost 80% size in a few weeks and to 95 to 98% size in a few months. And that is why you can donate a part of the liver and the liver grows back really fast. That is living donor liver transplant. But let me tell you, living donor liver transplant as a whole, the donor operation and the recipient operation together, we say it is the most complicated operation on the human body as of today. There is no operation, even a heart transplant is a relatively straightforward operation. So it's a really complicated operation. It should not be taken lightly, but it is a life-saving operation.
Exactly. So that actually answers a bit of my next question, that what exactly are the advantages for a living donor transplantation?
Well, ideally, there should be more of cadaver or transplant from people who have died. But then the families have to come forward and donate. Unfortunately, in an international patient scenario, the laws of a country restrict it. So first it has to go to people from the same state, then to people from the same country. So a person traveling from any other country would perhaps never get a cadaveric donor. Now, for a living donor operation, the biggest advantage is you can plan the operation. Now, when it's a cadaveric or a brain dead patient, don't know when the organ is going to be available. But when a living donor, you know that there's a family member who has agreed to donate. So you plan the patient and they travel together. You plan the date of the surgery. And you don't, in a brain dead situation, you're just waiting when the organ will be available. But here, you just don't have to wait infinitely. So the main advantage is that you can plan the operation.
That's very important to know that even the rules doesn't allow that we can get a brain dead patient here in India to do and get the donor. I mean to get the liver out of the brain dead person. But another thing which we are doing it successfully at this center is that we are a patient. He can get a blood related person, maybe his first cousin, maybe his real sister, brother, anyone from his
So it
family.
has
They
to
can
be
donate.
either a first cousin
Yeah,
or a second. It has a first degree or a second degree
second
relative,
degree
or it can be the wife or the brother-in-law. But it has to be a relative.
relative.
You cannot have someone who is not related. This is a question that keeps on coming. Can we have an unrelated donor?
Exactly.
No,
No.
you cannot have an unrelated donor. And in spite of the paperwork, the law of our country requires that once the patient comes here and the donor
They have
comes
to
here,
undergo.
they have to undergo an HLA or a DNA test to prove the relationship.
Exactly. And one of the most important thing, I mean, I've not mentioned it here right now. What are the symptoms of, I mean, when a patient, maybe a patient has a disease and he may not be knowing because we have most of the viewers based in Africa. And we could keep on getting that what are the symptoms attached to a liver transplant, let's say, and what are the symptoms from which they can understand that they have a serious liver problem.
So basically, who needs a liver transplant? A patient who has liver cirrhosis. Now, how do I know that I have liver cirrhosis? The cirrhosis will happen inside. I'm not having a look at my liver. So, how does the liver speak out? How does the liver say that I am not well? So, there are some symptoms which are very obvious. One can be jaundice, that is yellowing of the eyes, yellowing of the skin, if it is there for a long time. Now, we all know people can have jaundice, exactly. But the usual kind of jaundice due to hepatitis A or hepatitis E, the jaundice happens, stays for some time, and then disappears. But if the jaundice stays for longer, or if it associated with some other problems, like suppose the tummy, the abdomen swells up with water, there is fluid in the feet, the feet swell up. So, water in the tummy, swelling of the feet, vomiting of red colored stuff. Okay. So, it's a bloody vomitus. Or there is black colored stools. Mm-hmm. So, if there is bleeding and as it goes to the intestine, by the time it reaches the stool, the rectum, it changes color and becomes black. So, even bleeding can be black in color when it is in the stool. The other things that can happen is the liver is a filter. So, what does the liver do? It removes the toxins from the blood. Now, if the liver doesn't work, those toxins or bad things like ammonia, they reach the brain. So, if the toxins reach the brain, then I don't behave normally. I become sleepy, my mood changes happen, my behavior changes happen, and sometimes I'm completely disoriented. I don't know what time of the day it is, I don't know who you are. Sometimes patients have very little problems, very interesting things. We find that absolutely okay. You ask him to calculate something, he is not able to do it. There's some research. Addition is very easy. So you tell the person to do 90 plus 7, he'll say 97. But you ask him to do 100 minus 3, he's confused because subtraction is a little more difficult. But very grossly speaking, so one, jaundice, two, red colored vomiting or black colored stools, three, swelling of the tummy, we call it ascites, fluid inside, or the swelling of the feet. Sometimes the urine output comes down, passes very little urine. Sometimes you get confused, disoriented, very sleepy, and sometimes you have other problems like some breathing problems and all. So these are the general manifestations or symptoms of liver disease.
So overall, a patient, he may not be able to do regular, household or maybe official work if he is into some professional lifestyle.
It really wrecks your life.
I mean, I can understand from all these symptoms that he cannot perform his regular duties.
There's something. If you see a hotel door, you see in Western movies and all, the hotel lobby has a door which is a revolving door. You go in and out through the same door.
Exactly.
So we say in a patient with liver disease, it's like a revolving door of the hospital, which means you are sick, you come to the hospital, you get discharged, and in a few days you again come back into the hospital. So it's like getting repeated hospitalizations again and
Again and again.
It's a revolving door. Exactly. So ultimately, every time you're sick, you spend a lot of money over years, and one of those times the complication cannot be managed, and the patient doesn't do well.
Exactly. So the first and foremost thing which is advisable when you find a bit of symptoms like these, that he must undergo a liver transplant surgery in order to avoid further complications, maybe it lead to death as well. So that's very important to know. Even if you have told me all the advantages, are there any side effects involved to a liver transplantation?
The liver transplant is a major operation, so obviously it is not 100% successful. The overall success rate is around 90%, which means when we operate on 10 patients, 9 out of them will go back home, 1 will not go back home. Out of those 9 patients who go back home, we say that 8 go back home without any complications.
Okay.
1 goes back but with some complications. So we say it's an 80% smooth success, 10% success but after a lot of complications, and 10% it's a failure. Now, suppose you are in that 90% and you undergo a successful transplant and go back home. Now, what is life like after all this? So, you must be prepared to take at least one medicine for your whole life. So, that medicine sort of depresses your immunity so that it doesn't reject the liver. It is anti rejection medicine. Okay. Or immunosuppressive medicine. It's called tacrolimus.
Okay.
One of the reasons why transplant is successful is because tacrolimus is so effective. So tacrolimus has to be continued lifelong. So you must be prepared for that. You must be prepared for blood tests, very simple blood tests every 3 months, and those tests need to send back to us by email so that we keep adjusting the dose of tacrolimus.
So same medicine needs to be adjusted.
Yes, the dose needs to be adjusted. And yes, there is a slightly higher risk of infection than the general population. And there are, in some countries at least, we see that there is a slightly higher incidence of some cancers, but that's 5-10 years afterwards.
And let's say a patient who has already taken a lot of alcohol and after that he has underwent a liver transplantation, and again when he goes back after the surgery, so what kind of suggestion would you give? He should totally avoid, I mean, I believe he must avoid alcohol totally.
Once a person has undergone a liver transplant, any amount of alcohol, even a very small amount of alcohol, can cause liver damage very rapidly. The term is called recidivism. Recidivism means going back to alcohol. Now, what does recidivism actually mean? Recidivism means going back to criminal behavior. So,
it's a kind of a relapse.
Yes. So, taking alcohol after someone from your family has donated a liver to you, and then you go back to alcohol, and then damage your son's donated liver or your daughter's donated liver, that is the worst thing that
actually. I mean, you have to understand, let's say, you have taken a liver from your close one, maybe your son, daughter, wife, and after that, you again start doing the same thing I mean, once you go back at home, how will the patient, how will the donor who has donated you, how will they think?
So that is why we never do a transplant before someone has stopped alcohol for at least 6 months. So someone has to demonstrate that I can stay off alcohol for at least 6 months to be a candidate for liver transplant.
So next question is, is there any right time for the liver transplant? I mean, let's say you get to know from a patient that he has a symptom, but one of the answers you have already given, let's say alcohol, a patient who is taking a lot of alcohol, you're giving him a time frame of 6 months to stop it, and then we do the transplant.
Yes,
So
yes.
is there a right time?
The trick to transplant is that you should never do a transplant in someone who doesn't need it, and you should never do a transplant in someone who is not fit for it. So you can't do it when it's too early, because transplant itself has only a 90% success rate. So you do it on a person who doesn't need a transplant, and that person suppose has a complication, then you have unnecessarily created a complication. So we cannot do it too early, but we cannot wait so long that the water in the tummy has got infected, that the kidneys have started creating problems. Then you do a transplant. Then the success of transplant comes down from 90% to something as low as 50 to 60%.
That's basically a risk, too much risk.
So the biggest problem we find in India is that people know that transplant is happening. People know that India is a good center for liver transplant. So patients in India tend to wait and wait and wait.
Actually, yes.
And when patients from India come for a liver transplant,
It's too
the
late.
disease has already advanced and the success rate comes down. On the other hand, perhaps patients who come in from other countries, they know that transplant is not available in their country. So they perhaps time it right. That when the disease happens, they start making inquiries and they know I cannot suddenly have a liver transplant.
Yes.
So they plan it
They
well.
plan it.
And in those cases, then the results become much, much better.
That's very, I mean, you guys need to know that once you have already got to know from your local doctor, or if even if you're visited here in India, you need not delay it for a very long time. You can plan it, but in a very dedicated manner so that it is not too late. And then only the transplant becomes a successful. Maybe the which Dr. Ray is saying that 90% is successful. So you have to be at a very right time. I mean, you have to reach at a very right time. Uh, what is the, before, let's say a patient gets to know that he is planning to undergo a transplantation, what are the pre-evaluation you generally do before they come here or once they arrive here with the donor or maybe with the recipient both?
So, in an international patient medical tourism scenario, we look at trying to complete all the basic workup in the home country itself. So, the idea is that whether a person needs a transplant or not, that must be decided all over emails and reports sent over email.
Yes.
The basic donor workup, that is, whether the patient has a completely fatty liver or is overweight, the donor is overweight or fatty, that should be obvious from the test done in the home country. So we check the blood group for the donor in the home country, we do the blood test in the home country, but the final evaluation for the donor will only happen by a very good quality CT scan and MR, which is done here itself.
Once they arrive.
Yes. But the basic test, actually, it is very easy to decide whether someone needs a liver transplant or not. Only thing you need to do is you need to be able to get onto the internet and look up Google.
Yeah.
There's some very simple test called child score. Child doesn't mean children. Child means it's named after someone, a scientist who had done this scoring system. So all you need to do is go to Google and just type in child score calculator and just enter 5 things which are written there. You just need to enter a few basic tests and whether you have water in your tummy or not, and whether you get confused or not. And the calculator will give you the child score, and that will say whether you are in stage A of liver disease, stage B of liver disease, or stage C of liver disease. If you are child A, so you and I would be probably child A because we don't have any liver disease, so we are not candidates for transplant. Child C, definitely candidate for a liver transplant. Child B, there's some tricky issues, so the doctor will have to decide. So it's as simple as that. In fact, when we get reports, we are basically looking at an ultrasound report, which tells us how the liver looks and whether there is water in the tummy or not. We are looking at liver function tests, which are very basic blood tests available all over the world. We are looking at PT-INR, which tells you the blood clotting ability. We are looking at creatinine, which tells you the kidney function. And it helps if you tell us the platelet count. That's it.
So they can
blood
basically
tests,
send us complete
blood tests and ultrasound. That's it. And we can decide whether someone needs a liver transplant.
So it's very easy for all of you to send these basic reports, and with the analysis within maybe few hours, we can let you know that whether you have any liver-related disease or not. And what are the precautions after the transplant for donor and the recipient as well? Should they few precautions?
Yeah. So when so once you land in hospital, land at our center. So normally you would have a transplant within about 7 days. That's the time it takes for the evaluation and the government formalities. Then you have a transplant. The patient stays in hospital for 21 days. The donor stays in hospital for about 10 days. After 10 days, the donor is discharged. We ask him to come after 3-4 days, and if he's fine, in another 2-3 days, he can go back to his home country. We normally say that he would be out of work for about a month max. We advise him to avoid riding a bike, avoid contact sports like football, boxing. Although we have had the donors, there was a donor from Afghanistan who was the national rugby captain and a kickboxing player, champion.
Okay.
So at 10 months after donation, he came back to Bombay to play for his home country.
Really?
So, but normally we say 3 months later you can get back to light exercises. After 6 months, you forget that you ever had the donation surgery. But no medicines are needed 3 days
For
after
the donor.
discharge.
For the donor.
Yeah. Donor operation is a safe operation. We have done more than 1500. Dr. Subhash Gupta is the pioneer of liver transplant. Dr. Subhash Gupta is the director here also. So I work with him. So 1500 transplants we have done, and donor complications have not been anything major, but it is a major operation. There is a risk of around 0.03%. There have been donor complications otherwise, but the trick is that the donor tests have to be completely normal. We will take a donor only when all the tests are normal. That would really bring down the potential risk for any donor. But yes, no long-term medicines for the donor because, as I said before, the liver grows back. About the recipient, what we usually advise is you have to avoid infections. So that's why we advise a face mask, which is usually we advise to wear for about 6 months when you go out or when you have visitors at home. We very strongly advise that you avoid raw things. So don't have raw salads because sometimes infections come into them. When you take fruits, ensure that you wash them, then peel the fruits, then again wash them and then have it. And if you have visitors coming, then you just keep a hand sanitizer at home, and so that the visitors use that. So the basic idea is that when a patient gets an infection, it is either when somebody comes and cuffs on his face or through hands. So the hands have to be clean and he wears a mask.
So basically, all these precautions are actually very helpful for everyone, even if someone who is not even suffering, but they have to take a bit more precautions after undergoing the transplant.
Yeah. And if I were to have fever, cough and cold, I would probably not take any medicines for that. But if after transplant I have a small infection, even then I would have to go.
Is it because of the immunity level that goes down?
The immunity has been brought down deliberately by medicines so that the body does not fight the foreign liver.
I mean, to avoid the rejection.
Yes. And
so the next question is basically on the rejection of. I mean, even if the rejection happens, what can be the main reason or the causes for the rejection?
Yeah. So since we have already got into a lot of detail, so let me go into a little more detail. So one is non-function of the liver, which means that everything's fine. The liver is put normally. The blood is going into the liver. The blood is coming back from the liver, but somehow the body is just not accepting the liver. That is called non-function of the liver. That happens very rarely and basically has no treatment. But that's a very rare situation. And that is one of the reasons why we say that in 10% of cases the
becomes unsuccessful.
Failure happens. So one of them is graft non-function or liver non-function. On the other hand, rejection. People think that rejection means the liver is not working. It's not like that. Rejection means that the body is trying to fight the liver. It just means you need to increase the dose of medicines. That's all. So very often the patient will have episodes of rejection We just give some medicines, and mostly they are all manageable.
So do they get the same symptoms before? I mean, before they used to get the transplant?
Usually they get no symptoms, but when we are doing the blood test, we find that the liver enzymes go up or the bilirubin goes up, and
Okay.
that's when we start treating it. We
So
don't wait for
these
symptoms
kind
to
of
appear.
patients, they need to be extra. I mean, they have to take more precautions for their further life
No, nothing.
just because of the medicine.
Just do the test regularly.
Okay.
Just get back to us if those reports are wrong and when you call them so that we can treat it. But no long-term implications.
So when I think we have already discussed about the total recovery time for both the recipient and the donor after the transplantation. So you have already told that like it's like a 6 months time for the donor, he'll be fit perfectly, even if a sportsman or maybe.
By 3 months is usually quite
Okay.
fine. 6 months is the limit we say for really contact sports, boxing and all that.
Okay. And for the donor, I mean for the recipient as well.
For the recipient, yeah.
Same time.
The one question people keep on asking is how long will I survive after a liver transplant? That's a big issue. That is relevant only in case of hepatitis C because hepatitis C really comes back and attacks the liver. So what we do is if you are having a liver transplant for hepatitis C, in that case, 6 months after a transplant, we check your blood for hepatitis C, we check your liver, and then we start medicines to attack the hepatitis C virus so that the hepatitis C doesn't damage the liver. So that takes care of hepatitis C. All the other things, alcohol, so don't have alcohol, you don't have alcohol, you'll not have liver disease again. For hepatitis B, there are excellent tablets available. You just need to take them for a few years, and after that, you'll be, relatively cured almost of the hepatitis B. So that's for most things. So normally, you would lead a very long life. Now, in fact, the first successful transplant in the world was in 1946. A small girl was operated for biliary atresia. She was a few months of age, and that same lady, pictures with me, it's a very impressive thought that she is now 46 years old. She is surviving 46 years after the transplant and doing well. So that shows how the liver transplant
it
can
all
change
depends
lives.
upon the kind of dedication towards the precautions or the medicines a patient need to take after the transplant, and his courage and his will towards positive living. That's very important.
Yeah, that is very important. Surgery has improved a lot over the years, but I think it's the medicines which have been invented in recent years which has really made the difference to the quality of life.
And how are these medicines? They are costly, or I mean, it is easily affordable, and
Well, in Indian rupees, if I would say that the patient would have to spend around 4,000 to 10,000 rupees per month for
per
whole
month.
life.
Okay.
But the good thing about it is that the cost of these medicines will not go up. The cost of these medicines are every day coming down because more and more patients who have had kidney transplants and liver transplants are taking these medicines. So naturally, the cost of
the
these
more
medicines,
supply,
so the cost of the medicines
coming
really
down.
coming down.
Okay. And last, I mean, lastly, I would like to discuss with you as we have read about that, you have been doing a lot of cases, liver transplantation on children. I mean, that's very important for all of us to know that what are the, I mean, special care or how you are actually doing. I mean, what is the difference between an adult liver transplantation and a children's liver transplantation in a technical or more scientific way?
I am personally very passionate about liver transplant in pediatric group. Uh, we have our group has done a lot of good work in this field. Some of it is quite innovative, and we are doing it regularly nowadays. So the minimum age that we have done a transplant is 5 months of age, and the maximum is 74 years of age. So that is the spectrum. But the difficult thing about operating on a small baby is everything is really small. So whatever is joined, they are very fine vessels. Although we do it under magnification, but they're very fine vessels. So the chances of them getting blocked is a little higher. So the success rate in a pediatric or a small child would not be 90%, would be closer to 80%. The advantage of pediatric liver transplant is that the donor operation is very safe because the father or the mother, whoever is having to donate the liver, is donating only a very small part of the liver. So the risk to the donor really becomes very, 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 very low, which makes us really comfortable when the risk is low. And sometimes the children accept the liver much better than adults. So that is very gratifying. And then when you see those children growing up into adults and leading productive lives, that is quite a satisfying. So
those children also take the same medicine which you told
yes,
me
but in
until
a
they
totally different dose,
different
much,
way,
much,
maybe
much
low.
smaller dose.
So thank you. I mean, that is all which we wanted to know. And if you have any other important information which you would like to share with our viewers, or as you have already told that uh, people they should take less of alcohol and they should not get addicted.
Yeah.
I mean, which may
The message that I would like to get across is many of you would be listening to this, whatever I've been speaking, and I'm sure most of you will never ever require a liver transplant. Some of you will. But the message that every one of you should have is hepatitis B, hepatitis C, and alcohol can cause liver disease, which may lead to liver cirrhosis, which may lead to liver transplant. The unfortunate thing that happens in many countries is that many patients, thousands of patients die every day of liver disease without ever knowing that a liver transplant might have cured them. So please spread the awareness that yes, if you have liver disease, if you have liver cirrhosis, maybe a liver transplant can cure your problems. And it is a quite a standard procedure. It's no longer an experimental procedure. The results are quite predictable. So at least the awareness that liver transplant is now a standard modality of treatment. Uh, this message should go across throughout the whole world, especially in developing countries like India, some countries in Africa, Asia, where the awareness level is really low. Thank you.
Thanks a lot. Thank you, Dr. Ramdeep, for such important information. And we thank all the viewers for watching us. And we hope that you get to know today more, important information for liver transplantation or liver related disease. And keep sharing this important information to your loved one, to your friends, or maybe in your family, so they also get to know this information. So we will all see you next time with another important medical related information. Thank you. Have a good day.